anybody calls my office and says, hey, I just have a question for the doctor, can I just ask him this question? My secretary will say, no. Okay? She's very good at screening me and saving me. Okay? And she will not let somebody talk to me. Even if you're a doctor and say, I'm a doctor, I just want to talk to him. He'll maybe answer, he'll maybe call you back, but you cannot talk to him. So that's just the way I have to protect myself. So if you're a doctor, sometimes I'll call you back if I know you. If I don't know you, I may not call you back. If you're trying to sell me something, you're definitely not going to get a call back. So if you're a patient, the way to start is with what we call a case review. It's also a consultation. And this is very detailedly laid out on my website. It says first steps. Contact the office, schedule a case review. Then you go download the paperwork. It's all on the website. Fill out the paperwork, send it back in, and we'd have the case review. And I have some patients that don't do anything beyond that, because they didn't like me or something, or they had a different thought, they wanted to go a different direction, or just wanted some questions answered. I'm never going to give you diagnostic information on the case review, so don't call and get a case review thinking that I'm going to tell you how to treat your Lyme, because that's not going to happen. So, then at that case review, it's for me, and there's people that I don't accept as patients too. So if I don't feel like you're a person that really wants to get better, I don't accept you as a patient. I don't like to lose. So, and believe it or not, there's a number of patients, and they typically tend to be chronic Lyme patients, that they're getting a lot of secondary gain. You know, they don't have to work anymore, they don't have to do this anymore, they don't have to do it anymore. You have to be careful and guard yourself from that if you're in a chronic illness. It's just human nature. Hey, I get a lot out of being sick. I don't have to do anything anymore. You have to guard yourself, and you have to really check your heart on that. You know, you wouldn't be at a Rife conference today if that was you, so I can say that. Of course, no, it's being videotaped. Cut this out! So, and then the next way is if you choose to do a genetic consultation with me, there's a cost to that. So the cost to the case review is $199. The cost for the genetic consultation, you have had to have done your 23andMe, or you have to be in the process of doing that. And then once you get the data back, then you call and schedule, or if you already have the data, you can schedule the 23andMe review. That's what we call it. Then I need your username and password. You know, I'll get your username and password. I'll produce a document that I said is about 30 pages, and it'll have a whole bunch of these on there. All the data of all these genes. And it'll have a whole bunch of written information where I took all that written stuff. It's not on this slide. Those little boxes that have written stuff, it'll have all that. So solely looking at that can be extremely helpful. And you are required to watch my videos on the genetic slides, because I'm not taking my time to re-educate you. So that's what we have these conferences for, to educate you. That's what we're going to put this in a video for and put it on our website to educate you. And I've made a whole bunch of videos like this going right through a person's 23andMe, educating them. So I don't want to have to say it again. So I want you to watch those videos. And really, honestly, at the end of the day, I have a sore throat. So I need you to do your homework and your side, and then I'm going to make recommendations. So that 23andMe review is only about 15 to 30 minutes. And then I will send you my recommendations based upon that, which will be another sheet of paper with some specific nutritional recommendations. And you can choose to buy those supplements from me, or we have a lot of patients that are from other doctors. And they can get them from their doctor. So get them from somebody who uses those supplements, or if you're a doctor, you can sign up and get those specific supplements. That cost for that is $425. So it includes the gene report, it includes the supplement report, which is the recommendations. And it may include like that histamine sheet, or you have a bunch of comp defects of how I wrote a paper on that, but actually I put that up on the website now too. So I put the histamine sheet up on the website too. And then any follow-up beyond that, let's say, okay, 3 weeks down the road, well, I'm feeling a little bit better, but I'm not feeling 100% better, or I feel worse, what should I do? You can't just call the office and say, can you just ask the doctor what I should do? Should I stay on this? You have to talk. You're paying for my time, you're paying for my staff's time. That's literally what you're doing. So the only way we can figure it to be fair across the board is if you talk. You can set up another on telephone visit with me, and it's 15-minute chunks, and the cost for me is $187. The cost for my staff is $65. My staff, Janelle, is extremely educated. She's been with me a number of years. She can probably answer most of your questions. So you'd set up an appointment with her, or you'd set up an appointment with me, and you'd get those questions answered. And we put that all together in a written form. It's called our 23andMe agreements, because we want everybody to understand the boundaries just so it's safe. So you don't feel like, oh, they didn't listen to me, or one person got way too much time, or whatever. So everybody's fair, and it's just fair across the board. So before you do that, you are sent that document, and it is one of the last slides in here if we get to it, which I don't doubt we will, but it's a 23andMe agreement that you'll get emailed to you. So I always like to be completely above board, up front, what's going on. The last way that people come to me is to do a full program with me, and that's you're in our office for 2 full days. And that's a RIFE program. So I don't take people anymore. I just don't have time to, hey, I just have an autoimmune disease. Can you just test me on what I should take for mercury toxicity? I can't do that anymore. I just can't. So it's either just watching my website, learning from it, downloading my books. Number 2 is a case review, and then deciding what to do from there. The number 3 is you do the genetic review piece with recommendations, and then you can do follow-up consults with me. But again, those are only based upon your genes. In the follow-up consults, you can't say, I'm still having problems, and what should I do for mercury toxicity? Well, I don't know. I didn't do an exam on you. So we're a little limited with that. So those are really meant for people who are using a really good functional doctor outside of our clinic, but just need the genetic piece. Or they're really doing a really good job managing their health, and they just need, this is the missing piece of the puzzle. Can I get help with this? I can't find anybody locally. There really are. There's probably only about 250 doctors that know what I'm talking about here in the world, honestly. So it's just a lot of study. You know, I just did a seminar a couple months ago for doctors, and they wanted to learn Lyme, and I'm like, okay, are you doing this genetic test? They don't know what I'm talking about. It's like, okay. So it's fun. Why aren't you learning this stuff? Of course, I don't play golf, so I guess it's give and take.
Does anyone do this with you, or are you solo practice?
I am by myself. I don't work good together with people. I have a very high expectation. All right, sorry about that. Do I need B12? We kind of already covered this, but actually our genetic profile comes out with a reading. So there's other reasons. If I have an MTR, an MTRR gene, we didn't really hit on this really hard, but this is how we recycle B12. This person with a double allele MTRR gene defect does not recycle B12 very well. Matter of fact, if you do a blood test on their B12, they might have extremely high B12. Why in the world would you put this person on B12? Their blood test is like off the chart. Well, it's not getting into the cells. So your genetics are really important. Also, how do you get B12? So if you're taking B12, how you absorb B12 is through this chemical called intrinsic factor that then has to bring it across a healthy gut. If I have FUT2 gene defects in other genes, then I'm not even absorbing B12 very well. That's why you have to use sublingual B12. And the form of B12 is really important based upon your other defects. Right? It's not that difficult. These are other genes that support the making of SAM. And we can't get into all of these. But this is all in this pathway, this methionine pathway. Its whole purpose is to make SAM. So important for you to make SAM that God made multiple pathways for you to make SAM. So if you have defects in certain pathways, it'll be carried on other pathways. And I should say, these are really cool charts. I love them. Thank you, Dr. Ben Lynch, for putting these together. His graphic team put this together. If you're a practitioner wanting to learn this stuff, I'd suggest you go through Dr. Ben Lynch's courses. What's interesting on this is we got a bunch of questions on mercury toxicity. So let's just talk about toxicity in general. Toxicities can block any of these pathways. So I can have a perfectly open pathway, meaning I have no genetic defects, but I have a toxicity and it blocks that pathway. This is one of the theories, actually, with why there's such a high incidence of autism in the United States versus other countries, that it's been researched that use the same vaccine schedule. Here was one of the conclusive differences. In the United States, doctors are taught that you should go home and give your child Tylenol so that they don't have any ill effects of the vaccine. Tylenol blocks the MTHFR pathway. So if I have a double allele defective MTHFR C677, I already have a 65% on average reduction of that function of that gene. And then you give Tylenol, that kid is toast. Other countries that don't have the same autism rate don't suggest Tylenol. So this is where I'm not, do vaccines cause autism? No, the toxicity causes autism. You have those defects and you have other compromised things, you're going to have you're going to have brain issues because of that. So if you have to choose a pain medication, and if you don't have that one ABP1 gene that detoxes NSAIDs, and that's clear, Tylenol is not your best choice, anyhow. Matter of fact, there's another friend of mine, Dr. Susie Cohen in California, who's a functional pharmacologist, who wrote a really nice book on the genes. Oh, she didn't write a book, but she wrote a book on the pharmacology and its function in the body and the ill effects of it. And she has a really nice chart system on how different pharmaceuticals block different pathways. So this is another reason why I may say I'm not going to take a patient. So a person's on multiple medications, it's like, this is going to be a really difficult case. So you're blocking so many pathways with those medications. You're on benzodiazepines, it's going to be a very difficult case. So the least amount of medications you can be on, the better off you're going to be.
Would her book be helpful? She got that sick PDF she put together.
Yeah, I think she's done a wonderful job.
What was the question?
Would her book, Dr. Susie Cohen's book, be helpful for a practitioner especially? I think it's really important. So these are all different genes in this pathway. I'm not going to go through them. This is an interesting one though. I touched on this before, the MAT gene. This one here, because this is so important in having a person having excess methionine with cancer patients. So if you're a cancer patient with a lot of MAT gene defects, you have to be careful that methionine is not driving your cancer. And a lot of those people know. We test our patients with kinesiology as well, but just looking at it from a genetic standpoint, if you have a lot of MAT genes and defects and you have cancer, probably good to be on a much lower methionine diet. Methionine is amino acid. Amino acids are found in proteins. So on a low protein diet. I have a video solely on that if you have cancer. It's called Cancer Diets, and I have a whole web page on that. Transsulfuration pathway, or also called the CBS pathway, it's how you get rid of reactive oxygen species. So that is how you make glutathione, how you make SOD. We touched on those two things already. How you get rid of sulfites. So people with defects in this pathway, the CBS gene can be like a brake. you have a defect in that, you'll push this pathway really hard. And these are the people that have issues with sulfites. Anybody have issues with sulfites? Can't drink wine, causes them to be all red-faced, causes them to feel sick. Yep, can be the sulfites in there, can be the histamine in there. So you'll look at this pathway. You need to support this pathway. They have a deficiency in glutathione. They're not getting rid, they're producing excess sulfites, excess ammonia. So people with defects here are going to produce a lot of ammonia, especially if you have urea cycle defects. That's going to cause a lot of symptoms too, similar to peroxynitrate, though it's not going to have the ill effects of causing heart disease and necessarily causing cancer, but you're going to have a lot of achiness, fatigue, is excess ammonia production. That's the CBS gene. It comes from homocysteine. And you all remember that homocysteine is the bottom of the methionine cycle. That's recycled back to SAM, right? You all got that 100% on the test I just gave. And then the CBS gene takes it down to the glutathione and such. So there's your ammonia symptoms. Kind of sounds like chronic Lyme, doesn't it? So this is where you go. So why does I have chronic Lyme? Because I have all these symptoms, right? Okay, does this bacteria and its co-infections floating around in your body, how does it actually cause these symptoms, right? Well, it causes symptoms because it affects pathways. And then excess things are made, like peroxynitrate and ammonia, and that's what's causing symptoms. Do you understand? So that's as you dig into why, and you keep asking that question, why, that's when you're going to get to some base things that you can really help a patient with.
What are the symptoms if it's too small to read?
I can't help you with your vision. What are the symptoms? It is growth retardation. Okay, so this would be excess ammonia in a baby and such. But mainly muscular fatigue, poor coordination, just all sorts of muscle symptoms and neurological symptoms and things like that. Because it depends on where it is. If it's in the muscles, you're going to have more muscle system symptoms. If it's in the brain, you're going to have more upper motor neuron symptoms. Okay? Is this helpful? Everybody's so quiet, is it? Yes? No, I just made this 2 days ago. Will it be on the website? As soon as we get that video back. Or you can buy it from Mike. That's what I meant. You should buy it from Mike. Sorry, Mike. He's never going to have me back again. The biopterin pathway. So this, remember, the MTHFR through the folate pathway feeds the methionine cycle to make SAMe, which then feeds the transsulfuration pathway to get rid of sulfates, sulfites, to make sure you're not making excess ammonia, to get rid of ammonia, to get rid of reactant oxygen species, reactive nitrogen species. That's your glutathione, that's your SOD, all those things. That also feeds the biopterin pathway. The biopterin pathway is where you make your neurotransmitters. Kind of important when you're talking about mood issues. Now I know nobody has mood issues here, but we still have to go over this. So, what does your mood come from? Well, does it come from things that you think about all day? Yeah, it does, right? But, so there is, when we talk about your brain, there's a chemical component, and that's what we're going to talk about with the genetics, and there's a neurological component, and that's what we talk about when I do a lecture on functional neurology. So when you're dealing with a Lyme patient, or a person with brain cancer, you have to rebuild these pathways. So when they have inflammation in the brain, or when you're talking about Alzheimer's or a dementia, so you're dealing with inflammation in the brain. So when I have inflammation in the brain, it's going to physically affect the neurological pathways. It's also going to chemically affect these metabolic pathways that we're going to talk about. So the neurological pathways are the physical neurons. So my prefrontal cortex has to connect with other parts of the brain. The prefrontal cortex is my part of the brain that makes me human. So this is where logic comes in. This is where I'm thinking. This is where I'm calculating. This is where speech comes in. My dog has a prefrontal cortex, but it's really little. So I can tell her to sit, and she can learn to sit because she does have a prefrontal cortex. But if another dog is running over there, her prefrontal cortex is not large enough to override what the midbrain is telling her. The archaeocortex, the deep part of the brain. That's your instinctual part of the brain. That functions outside of reason many times. She wants to obey. She loves me dearly, but her archaeocortex is sensing she needs to protect. So she's going to jump up and bark. And I have to go physically grab her and drag her back because her prefrontal cortex is too small. Her archaeocortex, her instinctual brain, is taking over. Yes?
It's true for some humans too.
Yes, it's true for some humans too. So as a human, we have a larger physical prefrontal cortex. But when we have inflammation in the brain, from a straight neurological pathway issue, it can block that communication from my prefrontal cortex to my midbrain. And I start doing things that are beyond reason. So is it true for patients? It was funny, but it is absolutely true for patients. So patients that have behavioral issues have typically a neurological problem, physically neurological problem, and it could be caused from inflammation, it could be caused by disuse, it could cause from everything. And they have a chemical problem, which we're going to talk about in a second. So neurological problem can happen because of inflammation, because of a chronic Lyme or something like that. But it can happen because of disuse. It can happen because the pathway was never created. That's what disciplining your child is. It's creating a neurological pathway. So if you don't discipline your child and tell them, no, you can't do that, how are they ever supposed to know that they can't do that? That's education. If my dog can learn not to go on the deck, my grandkid can learn not to go on the deck. Follow me? That's brain-based therapy. When you fire a pathway, that's brain-based therapy. When I learned calculus in high school, that was brain-based therapy. I fired a pathway that didn't exist. I didn't know what the teacher was talking about. Just what you're doing today. You didn't know anything like this. And if I'm doing a good job teaching you, oh, I get it, and you'll be relating it to things that you know about, now that pathway is starting to form. And I understand that pathway in your brain for genetics is just a gravel road right now. And maybe in me it's a 2-lane highway because I've been doing this a long time. But if you get into this and learn and learn and learn, no matter what it is you get into, I'm not asking you to get into this, it becomes a 2-lane highway and a 4-lane highway. And a job that you've done for years, and you're an expert at accounting, you're an expert at whatever you're an expert at it because you fire that pathway over and over and over and over. The more you use it, the more it builds, as long as you have the nutrients to build that pathway and you have everything else in place. But you get rid of the biochemistry, now all of a sudden you have issues with that pathway. So this person, they could remember things their whole life. They were an attorney. They remembered all these case things, and now they have this rapid onset dementia. Why? Well, the pathway was there, but they have some source of inflammation, maybe blowing out the pathway, or some sort of chemical imbalance, loss of chemistry. So the neurotransmitters aren't being created. Following me? So I liken it to a highway system. My frontal lobe's communication to my midbrain is a highway. I get Lyme disease, I get all this inflammation in my brain, or I get a concussion, I get inflammation in my brain, or whatever's causing it. It's like a flood. What's a flood do to a highway? It can wash it out. How am I going to rebuild it? You got to get rid of the flood waters. Just like one of my questions on my intake exam. Are you willing to make strict dietary changes? If you check no, you are not going to be my patient. If you won't get rid of gluten, you have an 8-year-old kid with ADD, ADHD, and they won't stop eating gluten and dairy, good luck with that one. You're never going to help them. You got this constant flood. You do brain-based therapy till your eyes turn green. But you got this constant flood. You're going to build up the pathway. It's like building a road back again, and the flood just continues. You never deal with the flood. You had to get the water down. Okay? The biopterin pathway is the chemistry of that. So, when we look at this is the biopterin pathway. Methyl tetrahydrofolate comes in here. It pushes this initial pathway. These are amino acids that feed the production of dopamine, norepinephrine, epinephrine, and serotonin. Those are your main neurotransmitters in your brain. So, the genes that we look at are the genes that hold those in place in your brain or degrade them. The first one is the MAOA gene that degrades serotonin. So this person has a double allele defect of that gene. They're going to have excess serotonin. If they are having a diet that is full of phenylalanine, tyrosine, and tryptophan, they're really going to push this pathway. They don't get rid of serotonin. Here's serotonin. They're making excess because they're eating all protein all day. So here's a 7-year-old kid with ADD, ADHD. All he'll eat is pizza and chicken nuggets. I can't get him to eat anything else. Okay, you're a crappy mother. No, I don't say that. I don't say that. I'm just kidding. I'm just kidding. Okay, so check your frontal lobe communication with that because you have to be a parent. Okay, but you cannot feed this kid all protein all day because all you're doing is feeding excess dopamine and excess serotonin. If they have defects in the COMT gene, in the MAO gene, you can't get rid of it. I feel sorry for the kid.
Yeah.
His brain is just roaring. He can't stop. He can't settle down. Dopamine is just like going crazy in this kid. Okay, and you could argue, well, the way this kid is made, he really shouldn't be sitting in school. And there's logic there. If you do have COMT defects and MAO defects, it's going to be very difficult to sit in school and behave and obey the teacher and look at the board and stop looking outside and stop looking at the squirrel. However, it is what it is, and we can do some chemical adjustments to help decrease dopamine and serotonin excess production. Follow me? So we're going to take this kid, this person has defects like that, and you're going to cut way back on protein. We have to look at the other genes too, because typically with these really bad cases with kids with ADD, ADHD, they have huge amounts of histamine. Huge amounts of gut inflammation equals brain inflammation. So you got to deal with the gut. Absolutely, you got to deal with the diet, or I said I wouldn't even take them. And then you have to look at this. Question back there.
I just wonder why the typical treatment for kids with ADD or ADHD, then is to give them medication so that it jolt their dopamine levels up. So I can't
Okay, so why is the typical treatment is an upper? Okay, because kids' brains react differently to medication than adult brains do. And there is a metabolic pathway that I can't remember for that. But if you give a kid, for instance, if you give a kid fluoride is going to be an upper for a child. It's going to be a downer for an adult. It's going to cause depression in adults. It's going to cause excitation in a child, in their brain.
But the amino acids wouldn't be different.
Right, not this. So this is how you make it or degrade it. But drugs have different effects on children. Good question. Does that make sense? Still with me? So it is, okay, let's say I'm not a child and I have some issues and I have, this is my gene profile. So I'm looking at mine and I have a double allele Mao defect and I have all these comp defects. No wonder I have so much anxiety. A lot of serotonin, a lot of dopamine in an adult who has a healthy frontal lobe is still going to have symptoms of anxiety, OCD, quick-tempered, ask your spouse, easily agitated, get angry easy, probably watching too much Fox News. But, I don't know. But, yeah, you probably are. You have to look at what you're feeding yourself emotionally too, right? And there's things from a spiritual standpoint that you have to do. But I have good spiritual people that are saying, I'm trying to hold every thought captive and I feel like I'm going crazy. You have to look at brain chemistry. So this is the way you can look at brain chemistry. And understand you can do a neurotransmitter assessment too and look at the levels of neurotransmitter. But remember, those are going to be a photograph of a moving train. So you almost have to do multiple pictures of that. Because that's going to change throughout the day upon demand. Following me? So from a chemical side, how would you intervene with a patient like this? You'd cut down on their proteins. And there's some specific nutrition that you could address as well. And we get into the next gene. Oh, this is the neurotransmitter profile that you could run as well. I also wrote a paper on comp and Mao pathway gene defects that talks about kind of what I just talked about. It's available on our website as well. This is the NOS gene right there that we talked about. I don't think I showed the slide when we talk about the NOS gene, but that's in the biopterin pathway. And when I have defects in this gene, I have excess free or what's called uncoupled nitric oxide synthase. And that's what could bond to the excess superoxide ion when I have superoxide dismutase defects. The next gene has to do with mood, is glutamate. Now this is something we want to talk about. How much time do I have?
30 minutes.
Okay, so glutamate is really important because it causes a lot of problems. Matter of fact, there's a new report that just came out a few weeks ago that excess glutamate in your body it converts directly to peroxynitrate. So glutamate is not a good guy. You need glutamate, right? So don't get me wrong, but almost everybody has excess glutamate. Especially if you have defects in this gene called your GAD gene. Your GAD1 gene, well, these two genes produce excess glutamate in your body, but this is how you're supposed to take glutamate and convert it to GABA. Glutamate is an excitatory neurotransmitter. Fine, I need to wake up, I need glutamate, right? Need to learn, I need glutamate. However, you have too much excitation of glutamate receptors and over and over and over again, you have dementia. You will burn out glutamate receptors. There's a good book written on this called Neuroexcitotoxins by Dr. Russell Blaylock. He's a neurologist who's converted to our side. And he writes a lot about glutamate. Now you've heard of glutamate in your diet as the name monosodium glutamate, MSG, right? But there's a whole bunch of different glutamates. Matter of fact, it does not have to be labeled anymore. Thank you, FDA. And it's labeled as natural and artificial flavorings. Because they are flavorings. What they do is they excite the glutamate receptors on your tongue. They're excitatory. They fire to your brain, and you go, ooh, that was good. I'm going to buy me another bag of those chips. So they're found in processed foods, Chinese food. I went into a Chinese restaurant a couple of years ago. It was a brand new Chinese restaurant next to a coffee shop in our town. I said, "Hey, do you use MSG in your food?" He goes, I said, "What?" He goes, "Don't believe any Chinese restaurant that says they don't use MSG. We don't sprinkle MSG on our food. I don't think anybody does, but it all comes with MSG. It all does. So unless it's one of those restaurants that's making everything by scratch, it definitely has MSG in it. Because that's what makes it taste better. Wow, I really like their food. It's really good. It's either the spices, it's the wonderful organic vegetables you're using, or it's the MSG. Because it's excitatory to your tongue, you want more of it, fires glutamate receptors in the brain, it burns them out.
It's also a lot cheaper than using good ingredients.
Oh, it's a lot cheaper than using good ingredients. Exactly.
So what receptor burns out the NMDA receptor eventually?
Yes. So glutamate is not good in excess. When you have GAD genes, glutamate is supposed to convert to GABA. And it does through this gene. GABA is a calming neurotransmitter. You need GABA to fall asleep. You need GABA to relax, to chill. So people with excess glutamate don't do that very well. So they're highly excitatory. It could cause anxiety. Now I didn't talk about on the serotonin, the MAO gene. A person can have too little serotonin, right? And have depression. So this MAO gene here, if I have those defects, I can cycle between too much and too little serotonin, having that gene defect. But you don't want to confuse depression with anxiety, because it is a fine line there. I have depression. Really? Is it really truly depression? Or are you constantly nervous? And you're constantly worried, and you're sad because you're thinking of the worst case scenario all the time. That's anxiety, that's not depression. So a true depression from a decreased serotonin is going to be a melancholy that has no explanation. So there is a difference, and you have to be careful with that, because you treat it completely opposite from a dietary standpoint. So a person with a true depression, you want more serotonin, right? A person with a true depression, you want more of its precursors. So a person that is on a vegan diet because they don't want to kill animals, or whatever ethical reason they want to be on a vegan diet, or their friend is on it so they thought it'd be really good too, and since they started this vegan diet 5 years ago, their depression has continued to worsen. It's probably because they have too little serotonin. Follow me? They need to get some protein in their body.
It seems like with the SSRIs, they're trying to treat both. Not that the meds are good in the first place. They're trying to treat
It's
anxiety.
very tricky. That's why they work with some people and don't work with other people. They work at different times, or they work for a period of time and then they stop working. It's very difficult. The other reason why you could get depression is this chiurenin pathway, and I better not get into any more of that. But you can pull tryptophan, what I call a tryptophan steal, into the IDO pathway, and you create quinolinic acid, which can cause depression. And that's probably the patient that doesn't work with the SRRI. It's really the IDO pathway type depression. So excess. And you'll also test those patients and you put them on a higher protein, and it actually makes them worse because they're stealing their tryptophan down the IDO pathway. So you can see can you see a little bit that there's not just like a cookie cutter approach to this? And the more we try to take a cookie cutter approach, it only works on a very small percentage of the patients, because you're not a cookie. Yes?
What about bipolar?
Bipolar, there's actually a gene that increases the risk of bipolar. It's a DAO gene, so it causes, at least this is the theory right now, that it causes this MAO gene to work, turn on and off, basically, whether they have the defect or not. So I think then the people with that DAO gene and the MAO gene defect have a greater degree of bipolar and schizophrenia.
Is it just one of the DAOs?
Yes, it is. I don't know if I put it on here or not. I did not. Probably on purpose. So you got to be careful because then people think, oh my God, I got schizophrenia.
How do you treat it?
How do you treat it? The same way that I'm talking about. You have to manipulate the diet, and there's some different nutrition that you can help with it. There's a whole bunch of other glutamate genes, and it's important with glutamate because remember I said methionine can feed cancer? Glutamine can feed cancer too. So if I'm not converting glutamine, which is this other gene, this GLU gene, the GLS gene, if I'm not converting glutamine to glutamate, I'm going to have excess glutamine, and that can feed cancer as well. So that's why I'm very careful on how much glutamine, even though glutamine can be very healing to the small intestine, you got to be very careful how much you use. So I typically don't use more than 1 gram a day, even on non-cancer patients. This is the NOS gene that, remember, that causes NOS uncoupling. And that one you would treat even if the person really doesn't have symptoms. This is the biopterin, how it converts from biopterin to tetrahydrobiopterin. And then there's other pathways that are important. The vitamin D receptor pathway, that's very important for patients. If they have a lot of defects in that pathway, they need to maintain, in my book, they need to maintain a higher vitamin D level than clinically, what would be considered clinically normal. There's cell membrane protection genes. This can lead to cancer. This is a very important gene right here, the sex hormone binding globulin gene, for women especially. So women in their teens and 20s that have a defect on this gene are going to be much more susceptible to menstrual issues, PMS issues. If you have a double allele defect, the chance of you having ovarian cysts and breast cysts is much greater because it affects your ability to hold progesterone. So you have progesterone issues. It's actually quite treatable. So knowing that you have that gene, knowing that your 8-year-old girl has that gene, you can really help prevent a lot of stuff with her. So that can be really helpful. And every woman that I've ever tested that has that gene defect, and I mentioned just what I said, goes, oh my gosh, I've had, I think every woman that I've ever tested, I've had ovarian cyst problem. I had the worst PMS issues when I was. So I think it's very clinically relevant.
Does this single mutation do it, or just
Single mutation is going to increase the risk of it. And then this iron oxidation panel is really, I think, important. This person doesn't have a lot of defects there. Is very important, and that's something that's really high with Lyme patients, is this iron oxidation panel. Their iron is being oxidized, so they have symptoms of anemia, and the worst thing they could do is go on more iron. So it's being oxidized. So there's some specific nutrients that you can help with that. So that is extremely helpful clinically, symptomatically. That can cause the majority of a person's symptoms too. With cancer patients, we almost always see MUTL homolog gene defects. So those are some of the things that are common with cancer and not common with Lyme, vice versa. Those are DNA repair genes. The urea cycle I just mentioned in passing before, but that's how you get rid of ammonia in your body. So if you're producing excess ammonia with CBS defects, that's the transsulfuration pathway, you're not getting rid of it through the kidney very well, you're going to have excess ammonia issues. Also with especially the ALS gene, I think it is, in here, you will have an increase in your risk of kidney stones. So you got to make sure that you're staying hydrated. There's a kind of a cool gene that was just research discovered just a couple months ago, the CAC gene. People that have defects in this gene, this person has none, have a much higher degree of sensitivity to EMFs. It's kind of neat. So I've had a lot of patients that have defects in those genes. So that's kind of interesting. And then these are the Lyme study SNPs that were tested that people had defects greater. This doesn't mean you have Lyme, but this means if you had Lyme, what categories you fit into, how you fit into that. Oh, that's pretty blurry. So is this valuable? Is it helpful? I didn't just read off the slides, did I? I taught you guys. You guys got at least a gravel road on how genetics work right now?
What lab do you use for the test?
What labs do we use for what test?
The Lyme.
The Lyme test?
Okay, you have all these tests?
So these Lyme SNPs have to do with us putting together.
23 tests?
This is the 23andMe, yes. This doesn't tell you you have Lyme, but this was a study that we did. By we, I mean the genetic nutrition people did with 150 known chronic Lyme patients. They took all that volunteered to give them their genetic data, and it was interesting to see the uptick that all chronic Lyme patients had in certain genes.
I
So
was just wondering if there was any other test besides the genetic one that includes blood work, or it's all done with this one study.
So everything that I told you today is the 23andMe, except I showed you a little snip of, maybe I did the organic acid test or a little snip of a neurotransmitter test. But everything I showed you that looks like boxes like this is from the data from the 23andMe. Yes?
If you had a client that had a problem with EMF, would you not use Rife on them?
Absolutely not. So the Rife helps with that. So if they had EMF, you'd really talk to them about, you have to really be careful to ground your house. So I know Mike's big into using grounds for your bed. That's a good piece to do, but that's only grounding you while you're in bed. So you're not in bed all day long. So where is your biggest source of EMFs coming from? Well, in the house, it's coming from your electrical panel, it's coming from your microwave, it's coming from your electrical equipment, your television, and your cell phone, right? Where's the external EMFs coming from? The biggest is from cell phone towers, smart meters, yep, from high power lines. So all these are EMFs, right? Now, our ancestors built wigwams on the ground and walked barefoot, right? So you were constantly grounding yourself. Of course, they didn't have smart meters and cell phone towers either. So we are insulting our body with electromagnetic frequencies that are doing ill health to us. So they're at the frequency length that are hurting us. Whereas the true Rife is not at a frequency length that's hurting us, it's at a frequency length that's helping us. So using the Rife is actually helping block EMFs. But you're not using the Rife 24 hours a day either. So you still have to do things like, this is a brand new cell phone that I just got, right? And I don't have my protection on there. We use a disc called a Hedron disc. That's a company out of Wisconsin. A patient that uses another company that he really likes too. So there's some cell phone protectors that are really good. We used to ground people's houses with a product that is a ground basalt that would help pull EMFs out of the house. It worked fairly well. Now we use this, Hedron makes a whole house disc that we use that makes it a little easier for people, but it's still good to ground your house. Basalt simply has zero charge. Remember, EMFs have a positive charge. The ground has a negative charge. So when you're grounding yourself, when you're walking on the ground outside barefoot, you're grounding yourself. That's why you feel better when you go walk the beach. So you're grounding yourself. That's why pets are good for you. Your dog is outside running around, grounding itself, and you come and you pet it, and you discharge all the positive electrons on your dog. Now get outside and play again. That's why people feel better when they get on a horse. That's why horse therapy works so good. The horse is standing on 4 grounded hoofs all day long. You put a child that's ADD, ADHD, if their head is just like spinning, you put them on a horse and they settle down. Because you are discharging all that positive electrodes that are not good for you. What? Spell grounding? Hedron, we sell them on our website for cheaper than you could buy them from Hedron. So grounding yourself is good for your brain. So we talked about brain pathology just a little bit, about brain chemistry, about the neurological part of brain and the physical part of your brain. And I'm a functional neurologist too, that I don't do that as much anymore, but it's fascinating and it's really important if you're going to stay healthy with your brain. So with our Lyme patients, one of the things we do to help build those pathways is use neurofeedback. So neurofeedback, connect electrodes to your brain and you're running a computer program with your brain, basically. It's very, extremely helpful when you have bad brains. Yes, you had a question.
Oh, I was going to ask about high fructose.
High fructose corn syrup. Really good for you. You should eat as much as you can.
I figured you were going to say that.
I knew you were going to say that. Yeah, it's toxic, right?
Yeah, but does it affect the...
Does it affect the brain? I think so. And I think it's a contributor to Alzheimer's and amyloid plaques myself. But I don't know if there's research on that or not. But
And do you think it's responsible for the high diabetes?
is it responsible? Absolutely. Is it increased diabetes rates? Yep. Again, but remember, my whole approach is I don't think there's necessarily one thing that's the total bad guy. And that's why these studies are never completely conclusive because, okay, in all these diabetes patients, not all of them were exposed to high fructose corn syrup. Because there's other things as well. You got to look at the giant picture of it. So, yes, those are some things that you should remove from your diet, as much as humanly possible. Yes?
You mentioned earlier that 23andMe is constantly adding new data. Do we have to contact them to upgrade? Or
No. So is 23andMe the one that's adding new data? Yes and no. So I have patients that did their 23andMe 2 years ago. Well, 23andMe is adding SNPs that they're testing for, but they're not adding them, in that big of increments. So if a person did their 23andMe right when 23andMe came out, then I might say, maybe you should run it again. It's not that the data that you had positive SNPs on are going to change. It's just that they're running more SNPs now. Because on some reports that people ran it several years ago, it'll say NA there, NA, because they didn't run those SNPs then. And then, so that it's helpful to have is more. But if you ran it in the last year, no, you don't have to run it again. Back there.
Curious if you have any concerns about personal data security regarding our 23andMe.
Do I have concerns about personal data security with 23andMe, having your gene profiles? I personally don't. It's like I don't care if the government listens to my phone calls either. I'm not saying anything. So it's what are they going to do? I don't know. I mean, it's like, what are they going to do with 1 million people's? I just don't. I mean, I'm as much of a conspiracy theorist as the next person probably, but then you get to a point of, what would they do with that? What would they listen to my emails? I don't care if they read my emails, So it's like, I don't, personally. Yes? Excitotoxins. 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 Yes.
For autism, the L-glutamine can help their gut, but then the glutamine is bad for the brain. So
Right.
you just not give it or limit it to a small...
You have to limit it. So it's patient by patient. So you got to kind of watch them. And so I use glutamine, but like in the product that we use, which is called our Clear GI, that has the only one that I have that has glutamine, and I use that sparingly. A full dosage only has, a full daily dosage only has like 900 milligrams in it. Where I have some patients that come in, they're taking 5 grams of glutamine a day. It's like, I don't care who you are, that's way too much. So just, if you watch the dosage on it, and plus look at the genes that convert glutamine to glutamate. If they have a lot of defects there, then you're probably safer with a little higher dosage because they're not converting it to glutamate very well. So you're safer with that. And you should look at their intestinal transit time, because if they're like losing it, if it's not staying there very long, then I would make sure you dose it out. And I like to do GI health things in a drink that they drink. Because if you're taking 900 milligrams at 9 o'clock in the morning, you know, you have a half-life of every nutrient that you take. So it's going to be gone by 1. So with something like that, when I say 900 milligrams a day, I mean 900 milligrams in a whole day, and I don't like to bulk it. So they're spreading it out throughout the whole day.
And then GAD takes glutamate and GABA, but what takes glutamine then?
I forgot it was on here. It's actually a brand new gene that we just pulled out just last week, actually. So to answer your question, how do we know we need to update it? Our software is updated as we find out what those genes do. 23andMe already runs the gene, but they don't know what it does yet. You know, so as the data comes out, we know what that gene does, then our software updates. And I actually call some patients back and say, hey, I was thinking of you. That I actually have to call some patients back, my staff does, this week. Thinking of you, here's a possible reason why we got stuck there, is now it shows this. So, of course, update their profile, and it'll update in my system to everything new, and then we'll be able to see. 3 minutes left. Yes?
In regards to EMS, what are some of the more common symptoms of people that have issues
With EMFs, usually neurological symptoms. So, well, brain fog and, you know, anything. I mean, you can have pain, it could be an upper motor neuron issue. It's affecting the parietal lobe of the brain.
Irritability, rapid heart rate.
Yeah. Yeah. Yes.
If I was dealing with all your different types of patients, can you just give me like an example of some of the supplements or the company that you use, and an example of your diet?
Yeah. So it so depends. Like almost, if you come in, you're a Lyme patient or you're a cancer patient, you're going gluten-free. So I mean that's just across the board. From a dietary standpoint, depends on their gene defects, the rest of their diet. So I don't think everybody should be vegan. I don't. I don't think everybody should be paleo. I don't think that. So everybody's a little bit different. Supplements that I use are, I probably use about 15 different supplement companies. So a lot of the genetic supplements are from professional health products. But there's a big mixture. So it's really hard because if I find one good supplement from one company, and I use that. So behind you there.
About the glutamine thing. So, you know, say somebody with a damaged gut, you know, glutamine is really helpful. What, in most situations, their gut probably eat up or absorb most of the glutamine before really getting anywhere else.
There's no guarantee that their gut, even if it's really bad damage, is going to eat up the glutamine. There's no guarantee of that.
And then are you talking more just in terms of isolated glutamine? Because, I mean, like a paleo type diet, or, I mean, a piece of chicken probably has a lot of fiber.
Yeah, but again, it's, you know, so dietary things, it makes a big difference in what you're eating it with. So if you're having a piece of chicken, how many milligrams of glutamine is in that? I don't know, 500 milligrams of glutamine? But it's got other amino acids that you're competing with. Yeah, so it's a balance. So it's even if you're putting on a person on a low protein diet because this kid has comp defects, and you don't want to feed that tryptophan, phenylalanine, tyrosine pathway to make more dopamine, it's not that he can't have protein, but maybe he shouldn't just eat. You know, maybe he needs to eat chicken nuggets. He's got to eat his vegetables too, or it's it, you know. It's a matter of what else are you eating with that. It's the same thing with histamines. You know, if you're just going to have a bottle of kombucha, that's a lot of histamines. But if you're going to have some kombucha with your meal of vegetables, then you're diluting that spike of that specific nutrient. So it's all about food combination too, and how much you're spiking things. We're cutting off, we're done.